The purpose of this hearing is to examine how state policies, like those in Missouri, are impacting residents' access to comprehensive reproductive health care services, including abortion.
Dr. McNicholas, what's the medical consensus for age of viability of a fetus?
I appreciate the question. So viability is a complicated medical construct. There is no particular gestational age. There are some pregnancies in which a fetus will never be viable. There are a number of different factors that we think about when we're considering if a pregnancy is or isn't viable.
Is there a legal consensus on the age of viability?
Not to my understanding, but I'm a physician, not a lawyer.
In your 10 years as a doctor, how many abortions have you performed?
So I provide a variety of different services, and
I'm not asking about the other services. How many
Right.
abortions have you performed?
So I can't tell you how many hysterectomies I've done, and I can't tell you how many abortions I've done. I've had a long career of taking care of people for a variety of things.
So you manage a facility, or you're the medical overseer of that. Can you tell me how many abortions the facility in Missouri performs each week?
I can tell you, and I believe it's publicly available, so I can give you a rough estimate of how many abortions we perform per year, which is, that? I think, roughly around 3,000.
What's the latest term abortion that you've performed, like gestation period in weeks?
So my practice includes the provision of abortion up until the point of viability. And again, we already had a discussion about viability not being a...
So just give me the number in weeks then.
I don't know.
You don't remember the number of weeks?
That's correct. So
what about size of the unborn baby? Do you know the largest baby that you've aborted?
I'm not sure how I would even quantify that.
If I use the word fetus, do you know, you have no idea the age or gestation period of the fetuses that you're aborting?
So again, as I said, my practice includes abortion care through the point of viability, and as we previously discussed, that could be...
Let me put it this way. Is there any point of gestation beyond which you personally would not abort a fetus?
Again, given that the reality for people choosing abortion is that there are many reasons, there isn't a single thing that defines somebody's choice. It is a reflection of their...
You seem to have a hard time saying this. This tells me you have a heart. Or at least you know that people watching this have a heart, and they would be concerned if you would just admit, which you won't admit here, that you would abort a viable fetus for any reason if the law did not prevent it. But it does give me hope that you still know in your heart that's wrong. Mrs. Stuckey.
I'm not sure. Can I respond to that really quickly?
If you would answer my question, you could, but you won't. So I'm going to use my remaining time asking Mrs. Stuckey, should any reason be a good reason for having an abortion?
Absolutely not. It's a child. It's a life inside the womb from the moment of conception onward. And I'm very troubled by how flippantly she said that there are 3,000 abortions performed every year of defenseless human beings, and the remark that abortion is moral.
Time has expired. I reckon
that kind of logic driving my lifestyle.
No, the time has expired. I recognize.
Give the others over 2 minutes over, Mr. Chairman. Mr. Chairman, we need to be fair on both sides of the aisle, please, sir.
You want to finish your...
Please, I'd like for...
No, finish your answer. Go ahead.
I don't quite understand the logic of saying that killing a child inside the womb for any reason whatsoever is moral, is healthcare. In what other situation, besides when a child is defenseless in the womb, do we call killing someone healthcare? Do we call killing someone moral? Can anyone on the pro-abortion side tell me a situation outside of a defenseless child inside the womb in which it is morally justifiable to kill someone simply because they're not wanted? And not to provoke a slippery slope fallacy, but truly what we've seen from Governor Northam's statements and from other statements that we have heard is that it truly is a slope. There is a logical and a moral slope to this, and it seems like the pro-abortion side is sliding down very quickly.
Dr. McNicholas, could you describe what happens in the process of an abortion to the baby?
So I appreciate your question, and I want to first note that abortion was around before there was any concept of life, liberty,
Could you answer the question? I only have 5 minutes,
the pursuit of
please.
happiness. The abortion procedure really depends on the clinical situation. When I speak to patients about their options for terminating a pregnancy, I start with where are we in pregnancy?
I only have 5 minutes. Could you speak to the process, please?
So I realize it's difficult, but in medicine, things aren't short. There's 100 shades of gray, and so it's impossible for me to take what is often a 50-minute conversation with a patient and answer it in 30 seconds for you. As I approach patients, I talk to them about what their options are for pregnancy termination, and that really depends on a variety of things, including what stage of pregnancy they're in, what are their other medical comorbidities or health problems that they have, were there any particular instances in previous pregnancies,
Okay,
for
I'm going to have to move
example.
on. Ms. Stuckey, could you describe what happens in the process of an abortion?
Well, apparently I'm the only one willing to talk about specifics. And it's just free online. Anyone can go look. Even Planned Parenthood's website describes pretty clearly what, for example, a D&C abortion is, which is the taking out of the amniotic fluid, drying that up from the uterus, which is what, of course, the fetus, the baby, needs to survive, and then dismembering the baby limb by limb with forceps. And Ms. Lawrence spoke to that being deceitful or hyperbolic. It's not at all. Please go look online and you can see what an abortion actually is. But again, we see that it's not me that's speaking in generalities. It is the pro-abortion side that's speaking in generalities because they know the grotesque nature of what an abortion procedure is. You don't have to be an abortion provider to know what an abortion is. That's exactly why I'm here. America is included on a list of only 7 countries, including China and North Korea, to allow abortion after 20 weeks gestation. The same legislators who are pro-abortion were happy to vote yes on a bill criminalizing animal cruelty on the federal level. And while I'm thankful for this, I only wish the same basic compassion could be extended to the most vulnerable members of our own species. Thank you.